Allergy. Introduction. They occur when your immune system mistakenly reacts to a harmless substance, causing symptoms such as sneezing and itching. The most common cause of allergies is dust mites, which can be found in virtually every home and most public areas. Other causes include pollens, such as grasses or weeds, food additives such as preservatives, medications, and even household pets. What is allergy? Allergy is an oversensitivity to a substance, which can be caused by pollen, dust, mold, or other substances that are found in the environment. It's important to note that allergy isn't just seasonal, it can happen year-round and affect any part of your body. Allergies vary from person to person based on what exactly triggers their symptoms. For example, some people are allergic only to animals like cats or dogs, and sometimes even fish, while others react negatively to many different types of plants like grasses and trees such as oak trees with acorns. These reactions will look very different from each other because both individuals had very different experiences growing up around those types of plants. Types of allergy. Allergies are caused by the immune system reacting to harmless substances. Food allergies, drug allergies, and insect sting allergies are the most common types of allergic reactions. Allergic reactions can be mild or severe. They can happen immediately after exposure to an allergen or take more than 24 hours to appear and may vary in severity from person to person as well as from one time period, for example, all day, to another time period, for example, just 1 hour. Allergic reactions are caused by the immune system. When you're exposed to an allergen, your immune system will release histamine and other chemicals that cause inflammation in the body. This can cause itching, swelling, and redness of skin, and sometimes even tissue damage if the reaction is severe enough. Allergic reactions can occur when you're exposed to something you're allergic to, an insect bite, or they can be triggered by medications, such as penicillin. Diagnosis of allergies. A diagnosis of allergies can be made when a patient has symptoms consistent with at least one of the following. History of allergic reactions to certain foods, such as peanuts and eggs. A history of eczema. A family history of allergies or asthma. The doctor will ask about your symptoms, including chest pressure and difficulty breathing, as well as eye irritation, such as redness, sneezing and watery eyes, an itchy throat, hives on the body, swelling around your mouth or throat, trouble swallowing food without discomfort, and any other unusual reactions you might have experienced recently, for example, hives after eating something different than usual. You may be asked if anyone else in the family has any known allergies or asthma problems, especially if there was a recent change in their health status, like experiencing severe coughing fits. Treatment of allergies. Allergies are a common condition that can be treated with a variety of therapies. The most common treatment used to manage allergy symptoms is allergy shots, which require you to go to the doctor's office every week for several months and take immunotherapy shots. If you have an allergic reaction, anaphylaxis, due to food or insect bites, your doctor may prescribe steroids or antihistamines as well. If allergies cause asthma attacks in young children, they may prescribe an epinephrine autoinjector, a device that delivers medicine directly into their bloodstreams when they're struggling with an attack. Vaccination for allergies. Allergies are a common condition that can cause severe symptoms, such as fever and runny nose. While there is no cure for allergies, your doctor may be able to prescribe medication to reduce the severity of your symptoms. If you're allergic to pollen, dust mites, or pet dander, dander refers to tiny particles that animals shed, it's important to avoid these allergens at home and work so that you don't trigger an allergy reaction while you're out of the house. If you have allergies due to environmental triggers such as food sensitivities or mold growth in your home, then these can also be managed with lifestyle changes such as avoiding certain types of foods altogether or increasing hygiene around areas where they've been present recently. Allergies are not contagious, meaning that you can't catch them from someone else. However, if your child has allergies, many times he or she will be uncomfortable and may even have trouble breathing at times. The good news is that there are ways to manage these symptoms so that they don't interfere with daily activities like school or work. You may wonder how allergies develop on their own without any exposure to something that causes an allergic reaction, but this happens all the time. The immune system creates antibodies when it encounters certain substances, like pollen, which means that when we're exposed again later on down the road, those same antibodies will recognize what they saw before as harmful and trigger an allergic reaction once again. Conclusion. Allergic reactions are a kind of immune response that occurs when your body's natural defenses recognize a foreign substance as harmful.